program under the Social Health Insurance Fund. Out of this, today alone, I've just confirmed from the CEO of Shif that 104,000 Kenyans have registered today. And allow me, Honorable Speaker, to plead with us as members of Parliament and as the people's representatives to be at the forefront in encouraging, promoting the registration of members of the public into the Social Health Insurance Fund. It might be politically expedient and very politically correct to speak to the gallery of how things are not working, but as we speak to Kenyans on how things are not working, let us remember that Kenyans have charged us with the responsibility to make sure that things do work for them. It therefore doesn't help me. Remember St. Peter's health facility there that mushroomed into a big health institution largely from money stolen from NHIF. You remember the other small dispensaries you saw in Tharaka-Nithi, in Meru, in Nakuru, and people are hemorrhaging resources from NHIF, Honorable Speaker. It is these hemorrhage resources from NHIF today, Honorable Speaker, that largely are fueling the propaganda you see being peddled against the Social Health Insurance Fund, Honorable Speaker. Today, Honorable Speaker, out of the 14.4 million Kenyans who have registered, 710,000 have done the mean testing score. And out of these people, Honorable Speaker, when you register, Honorable Speaker, and these are the things we need to be telling to members of the public, the moment you register today are telling us that the mean premium that Kenyans who have done the mean testing score of these 710,000 is 525 shillings. Because it is politically expedient and politically correct, Honorable Speaker, for me as a business person who is well-meaning, who is doing well, to do the mean testing score, and I'm told the premiums you should pay from your level of income, and also people to know that it is based on how you answer the questions that are on that mean testing score. If you own a car that you are paying insurance of 200,000 shillings, for heaven's sake, if you can insure an automobile, you can also insure your own body, your own health. And therefore, Honorable Speaker, you find people who are quoting very huge figures. But because of the answers they gave as they did the mean testing score, fact, Honorable Speaker, and these are statistics that you can examine and see and authenticate from the SHA website, Honorable Speaker. The mean premium out of the 710,000 people who have registered is 525. Out of the service providers, Honorable Speaker, 7,802 hospitals have signed up for this program. Honorable Speaker, there are a further 8,118 healthcare providers who have successfully registered to offer services, and out of this, Honorable Speaker, 7,965 have offered services under Shif to Kenyans. Therefore, for us to stand here, Honorable Speaker, in this house and elsewhere, in funerals and everywhere, to say, oh, it is not working, we are lying to Kenyans, Honorable Speaker. We should be telling Kenyans the truth. We should be educating Kenyans. And I know we may have failed in our communication strategy. We may have failed in how well we communicate and educate our people. But, Honorable Speaker, let us use this opportunity on this floor this evening to educate our people and let them know. Honorable Speaker, it is not fair that my constituents, who some are people who are unemployed, who are paying an average of 500 shillings at a time with my huge salary, Honorable Speaker, besides my business income, Honorable Speaker, and that salary is paid for by the same constituents that I was paying 1,700 shillings a month. And now because I'm being asked to pay 27,000 or 20,000 shillings a month, I start complaining and cry more than bereaved. But I'm not being honest with Kenyans to tell Kenyans I am crying more than the bereaved because I am more bereaved because I am paying 20 times more than what I was paying from money that is paid to me by Kenyans. That is the kind of honesty, Honorable Speaker, I want to beg that we exercise as we debate, Honorable Speaker, as we educate. Let us be at the forefront of offering civic education to our people. Because, Honorable Speaker, you have seen cases of cancer patients. You've seen renal care patients, those who are undergoing dialysis. And yet I had paid for all my NHIF. If you are unemployed, the moment you sign up, automatically you can access a level 1, a level 2, a level 3 hospital without payment. The capitation that is going to the hospitals, the facility improvement fund. You know, I was so embarrassed, Honorable Speaker, over the weekend when I had a member of parliament pretending in Kikuyu that this Shif or Shifo, and saying it is not this Shifo. Shifo is a name for a chief. A member of parliament saying that they do not know the difference between Shif and Shifo. Yet, you are seated in this house, you legislated right from the first reading to the third reading to the committee of the whole house. You are here shouting aye, as the speaker said, the ayes have it. Then you go to your village to tell Kenyans that you do not know the difference between Shif and Shifo. That you do not know the difference between Shah and Shif. Honorable Speaker, I am saying I was so embarrassed because I would expect a leader elected by the people believing that that leader knows more than them, to be using that opportunity, Honorable Speaker, to educate their people, to tell them that if you have need to access renal care and dialysis at your dispensary or at your local level 4 hospital, all you need to do if you are unemployed is to do the mean testing score. You are advised how much premium you should pay. When you pay, Honorable Speaker, and I know these are the cries that Kenyans have raised, that the mean testing score is asking you to pay for the annual premiums for the whole year. That was the case under NHIF. You could not access renal care, cancer treatment, without paying your annual premiums, Honorable Speaker. And Kenyans were paying. Today, Honorable Speaker, because SHA, or the Social Health Authority, is yet to activate the insurance premium financing, they have now opened it up to Kenyans to be able to pay every month. Let us educate our people that you now can pay monthly premiums, access your dialysis, access your cancer treatment. Let Kenyans know that today under Shif or under the Social Health Insurance Fund, they can access dialysis, they can access chemotherapy, radiotherapy, free of charge if they are registered with this authority, if they have paid their premiums. It doesn't matter whether it's annual premiums. If you have access to insurance premium financing to pay your annual premiums, pay. If you cannot, discuss with them and pay your monthly premiums. Access those services. Honorable Speaker, my last point. Our county governments and our county governors, and I really want to plead with our county governors.
A minute only.
In a minute, Honorable Speaker, if our CEC's healthcare in our counties can take up the challenge, because other than the Kenyan public who are the major beneficiaries of this shift, Honorable Speaker, is our county governments. The facility improvement fund that we legislated in this house, I know many politicians will not tell Kenyans that truth, that facility improvement facility empowers your local dispensary to have a committee that will even procure equipment and medicine at that local level. It is the number of people who are registered in that locality and who are registered to that facility that will enable the facility in your locality to access the facility improvement fund that will ensure that a hospital in Gatuna in Kikuyu, the far-flung corner of my constituency, the most remote part of my constituency, if they have a dispensary, Honorable Speaker, they will be able to access the facility improvement fund, be able to equip their dispensary, have medicine available at the dispensary, have money to hire doctors, and we legislated. We made it possible in this House, Honorable Speaker.
Thank you, Majority Leader. The Minority Leader will take precedence over you. Honorable Andrew Kwome, the Minority Leader will take precedence over you, the Minority Whip, for the avoidance. The Minority Whip.
Thank you, Mr. Speaker. And I want to thank Honorable Millie and
Kwome. Honorable Millie will always speak before you, whenever she wants.
Though that is discriminatory, because the tallest man should be speaking before. But Mr. Speaker, having said that, I want to thank Honorable Honorable Dr. Lilian Gogo for bringing this before the House. And Mr. Speaker, I just want to say that under Article 43 of our Constitution, it provides for the right to health to the highest attainable standard of healthcare, including reproductive healthcare. And legal framework, a new legal framework that replaces NHIF, and we passed 4 bills. And Mr. Speaker, I was in the House when those bills were being passed. I was especially opposed to certain parts of that bill, but that is now what under the bridge we have a new legal framework. Mr. Speaker, having listened even to the members, the honorable members as they move, Honorable Kimani Ichungwa and even the Honorable Nyikala and the Chair of Health Committee, one of the things that I can indeed say is that the proof of the pudding is in the eating. So it is actually too early to even say, we would be cheating ourselves to say that here are the benefits. We don't know the benefit yet. If you are an excellent person at monitoring and evaluation, you cannot say within a month that we can see the benefits. So yes, we will probably see the benefits much later. However, we can see photos of people who are in hospitals who are struggling to access health care. Those with renal issues, those who are cancer patients. And Mr. Speaker, even though I know Honorable Ichungwa is actually castigating a lot of the members who he says are pushing propaganda, as he's saying one. I don't know who that is, since I'm not too sure about, I'm not very keen on the politics of the mountain. But Mr. Speaker, what I want to say is that we need to acknowledge that there are very serious transition issues over this. Over this. And Mr. Speaker, if we lose a life, we can never regain it. I have a person who is very close to me who is undergoing cancer treatment right now and will not receive any treatment unless there's pre-authorization of payment. And Mr. Speaker, if me, I'm at the place where I am, maybe because they are able to do that, because we, for different factors we can. But the cries we are getting from our own constituencies, the cries we are getting from ordinary Kenyans is telling you that there's a huge problem with the transition. And this transition was not done efficiently. What I would want to encourage the chairman of the Committee of Health is, one, please do a kamkunji for members of parliament. I am a lawyer and I was here when this was passed. And a lot of us would want to sit here and pretend that we understand and know. Me, there are a lot of things I don't understand about this, and I passed this law here. What about ordinary Kenyans? Do an urgent kamkunji for members of parliament so they understand what this new system is all about. Number 2, we need to actually stop most of the things we are doing in this country so that members of the public understand and know how they can access health care. Because health care should be the most primary, right for everybody. Because if I'm already dead, how are you helping me? How will it be of benefit to me if I'm already dead? Even if you are to compensate, I will already be dead. So really, I think we need to take this issue more seriously than we are. Let us listen to the cries of Kenyans. If the health system is not working, a lot of the poor people can't access healthcare system, there is a problem. And Honorable Majority Leader, please listen. Please, the transition is not working well. Please take this and inform whoever needs to be informed that they need to take urgent action. The transition is not working well. Thank you, Lillian, for bringing this.
I would request we speak for not more than 3 minutes so that as many of us as possible contribute. The Honorable Omboko Milemba. I have not recognized you.
Thank you, Honorable Speaker. The issue concerning the new model of health provision in this country requires a consortium of all of us to deal with. It doesn't require even people to take podiums on one side and say that this is succeeding, while another team sits on the other side to say it's succeeding, because that will not help us. Another thing I want to say about this is that It doesn't even require statistics, quick statistics of we have treated several number of people. We have done this dialysis. I'm seated very close to the chairman, and he gave a number of such statistics. But even the leader of majority went ahead to give a lot of statistics. I was in a meeting over the weekend where the Minister for Health was called upon to speak on this. Honorable Speaker, she went straight into statistics the way I've seen this happen here, and she lost it. But later on, another speaker came, took her time or his time, and spoke about slowly. I was with the Honorable Maungu, and the second speaker really scored. So I really want to remove the first thing amongst members of parliament. There are those who are supporting, those who are not supporting, those who know, those who don't know. We don't know this thing properly. And we need to know it. If we don't know it properly, the local man will not know this thing. And therefore, because I know I have 3 minutes only, the first advisor is to go with Millie. Let's have a kamkunji. But I had another one, that we need to invite the Minister of Health in this particular assembly so that he may explain to us what is happening outside there. Because unless the explanation comes out, it will be difficult. Honorable Speaker, the other challenge is the ownership of the whole setup. The Kenyans are not willing to own up this particular new model of funding. And the ownership can only be developed if, as the members of parliament will go outside there and explain. And also involve other parties. The chair here talked about is having people within this, and I've asked him informally here, that there are people around who can actually do the mean testing and actually register people. I'm telling you, Honorable Chair, that there are no people registering people in this scheme where I come from. And I have decided, since Sunday, I decided that I'm going to help. So for me, I'm going to go out flat to register all my constituents. But we have to involve other players. Let's not say that we have enough staff. Those CHPs, if they were trained to actually register people in this scheme, it would work. After all, they know everybody. They know the indigent. So even as we do the mean testing, they can actually add up to bring out the whole thing to work properly. And I think that's the direction we need to take with this thing. Otherwise, once the Kenyan person is complaining, we are not safe, even if we give whatever number of statistics. So for me, we need to own up this model, go and explain it, and use every other people within the circles to see how the model can work. Thank you, Honorable Speaker.
Honorable Karoli Omondi.
Thank you very much, Honorable Speaker, for the opportunity, and thanks, Honorable Lilian Gogo, for bringing this matter to the floor of the House. I agree with the other speakers that the transition has been very bad in this particular matter. I mean, there are already patients with chronic illnesses who are already being served under NHIF. And I wonder why they just never made the full